I made it. Here to see Dr. Gulani, the infamous Dr. Gulani. Call him Gulani the Anomaly. So I'm at Dr. Gulani's office. My eyes are dilating right now, so if they look huge, that's why. And then there's some stuff playing in the background, but I'm waiting for my eyes to dilate. And I feel like I've just come to a friend's house. And if you come see Dr. Gulani, you would feel like that too. It's not just me. There's a woman from California that flew all the way here to get eye surgery that was out there. We were talking when I first got here. And I love coming here. I said, isn't it sad that I wish I could even make stuff up to come here? But yeah, so they have a new machine. And it was like a lot of money. They just got it like 2 weeks ago from Germany. And it actually sees like your eye cells and back into your brain. But I'm gonna sit down with Dr. Gulani and talk to him about all that I'm having and just a bunch of other stuff. So, because I know someone had said to me, and I was telling him that they said I don't know if it was optometrist or ophthalmologist, said that they couldn't get vision correction after 40. And we were talking about this. Well, maybe that guy can't do it, but Dr. Gulani can. So, yeah. So I'll sit down and talk to him, and you'll meet him, and his staff is amazing. And so, yeah, I just wanted to check in because I'm being dilated. So, and you don't just come here, like my appointment was at 9, but I know better now when I first came that Dr. Gulani is not like any other doctor that you'll ever meet. When I first came the first time, my mom and I came together, and we were waiting out in the waiting room, and there were like, I don't know, 6 of us out there, something like that. And all of a sudden he came out and walked around and introduced himself, and I was like, well, what's happening? And he just introduced himself before we, would be called back. And then you get called back, and listen, it's 11:30, I think, right now. And you're here like all day. He doesn't just like see you for 15 minutes and get rid of you. You're pretty much here getting tested and stuff. So, okay, here he comes. I'm gonna talk to him soon. Okay. We are looking at the advanced diagnostics suite, Dr. Gulani's office, and should see all the technology in here. And we're going to go through each one and bring up my tests.
Test that you just went through, Tracey, is what we call the Penacam AXL wave. It's one of the first in the world, a technology that gives me vision of each part of your eye and the perception. Okay, so if you look at your anatomy like an MRI, this is your cornea, and here's your LASIK flap from your LASIK surgery in Minneapolis.
Oh wow!
And that's your lens early changes. You can see that these are all your refractive errors. And what is important is I can literally go into your eye, piece by piece, and see it. And this technology took another level when it did this, which is again a great way. It gives me vision of each part of your eye, and you can see the quality is not that great of your previous LASIK area.
That is
right?
crazy.
And then you put it in 3 dimensions here from you to 10. And there you are.
Wow.
So you can see this is your eye. And I can go inside your eye. This is what I do on my weekend planning when you guys are gone, all patients.
That's inside my eye?
That's inside your eye.
Oh my gosh.
Right? So that's very important. This technology helps me decide what direction I'm taking, which area is really affected for your vision. That's Penacam AXL wave.
What's this one?
This technology is called the eye trace. Actually, guess what it's called? Tracey!
Tracey, and they spell it just like my name, yeah.
This again tells me, how each element of your eye is working. What's the toricity or astigmatism in it? And if I was doing a lens-based surgery, what's the axis I should go on? Again, visually oriented technology that goes far more deeper. As you know my concept, most people wear a suit based on height and waist, right? 32 regular.
Right.
To be measuring even down to the ankle. That also makes the surgeon more accountable, because now that I've measured that your left knee, for example, is bigger than the right, how can I not adjust that in my tailoring?
It's tailored to you.
Has to be.
These are cells, right?
These are the living cells of your cornea. We call this the endothelium. So most people have to assume they're normal. We actually saw it.
Wow.
The cells look like a honeybee pattern, as
Yes.
you saw, and we can see what's going on.
Wow.
Right.
Okay.
So in this technology, if you see, you know how people do histopathology of the eye?
Yes.
This is doing actually sections, optical sections. We call this optical coherence tomography. I'm seeing your eye literally like a histopathology, your entire cornea, that's your LASIK area. Here's your epithelial map. People look at topography. This is next level. I'm looking at the cells on the topography. That's why I know your LASIK flap has some issues, which we'll correct during lasoplasty. This technology is, what it does is gives me what is called optical path difference pattern, because it shows me your visual potential.
Right.
This is your astigmatism from your previous LASIK. We'll be fixing that. And how do you see with that kind of vision? That's also something that's coming up right here for me.
Wow.
So all these technologies literally take pieces of knowledge. And then this technology also, which we brought in.
This one,
All of these are state of the art. This technology gives me the length of your eye, and if I was doing a lens-based surgery like a cataract or lensoplasty, what lens to pick among 35 options.
Oh, wow.
Multifocal, bifocal, trifocal.
You don't have to think about it. This will tell you.
So have to think. Remember me?
Yes.
I
True. Yeah. You
I
take
use-
all the information, right?
And then I think.
Right. And then,
Very important,
And then
because
I think, yes.
I don't want
It gives
doctors
you
to
the
not think.
information.
Yes. I don't
Yes.
want doctors to not think.
Right.
All this is doing is giving me in-depth knowledge. So now you can
Information.
understand, if someone's going just for LASIK, they didn't even go through 1/10 of this technology.
Right.
Then how are you designing the procedure?
Right. Amazing.
Right.
Amazing.
Excellent. Any questions, Tracey?
Nope.
Great seeing you, Tracey, again.
Yes, like feels like I come home every time I come here.
Absolutely. And Tracey, you're an actually living example of what I believe in is safety first.
Yep.
We've dealt with each of your lesions at each visit, not going after all of them because
Right.
safety of the eyeball very important.
Yep.
And I'm very pleased. After
Yeah.
your pinguecula surgery, your eyes are looking really beautiful. Here you are.
Yes, they look amazing. Oh my gosh. Even I'm surprised. I have my
Despite-
confidence back. Thank you.
And despite all your travels all over the planet.
Yeah. Exactly.
You're horrible, Tracey.
Yeah, I know.
And with this technology, which is one of the latest in the world we brought in, it's called the XL Wave. You see how it gives me the vision that you are seeing with. You see this? This
Yeah.
E is actually your cornea. So it's
Wow.
giving me vision like pieces of a camera.
Like what I'm seeing.
Not only what you're seeing, which part of your eye is seeing that. So as you had, if you remember, you had a LASIK surgery, which had a bad outcome way
Yeah.
back in Minneapolis.
Way back
Yes.
in my 20s.
And that LASIK surgery had left the cornea with a distortion. So you're seeing the corneal image is not that good. Your lens in the eye is age-related change you're seeing here.
Okay.
Right?
Yeah.
It's not yet a cataract.
Right.
And the overall vision has halo and double vision.
Yeah.
So this technology actually breaks each portion of your eye for me and how are you seeing. So that helps me decide what am I doing for you. And when I look at you here, I can even tell the complete refractive error that you have been left with. It's called irregular astigmatism. That's also impacting your night vision, right? So this time when you're back, we've done the sparkle techniques all the time you're here with the whitening of your eye.
Yeah.
Now I'm planning to do a laser plastique. It's a no blade, no cut technique. I use the laser in a very gentle fashion. In a few minutes, I'll be shaping your old LASIK area, even clearing out the wrinkles of that old LASIK that you had in Minneapolis before, and bring you to excellent vision. So you
Without cutting or doing anything?
no cuts, no blades, nothing.
Well, even just like with the Pinguecula, like no stitches, no
No
nothing.
stitches.
You've never cut my eye.
Never.
Like,
Never.
wow.
That's what we'll do, and then we'll bring your vision back to 2022 kind of concept is not only give you your vision, but correct your old LASIK
Right.
and not cause more dryness. That's the other thing with this technique.
That-
LASIK,
yeah,
when you
'cause
cut,
I do-
especially
yeah.
in Pinguecula patients or Pterygium
I
patients,
had dry.
adds to dryness because it cuts
Yeah.
the nasociliary nerves in the flap.
Yeah.
Right? So hence this technique is unique also for patients with dry eyes, Pinguecula, Pterygium. You can correct their vision so they don't have to wear contact lenses.
That's amazing. That technology is amazing.
That's what
That
we
you
do
can
here.
see what I see,
Exactly.
which is blurry. I
Yes.
drove cross country.
And maybe you'll drive straight in the road now this time.
Maybe I won't have so much anxiety anymore. I can see actually. Yeah.
Yes. All those people waving at you
Yeah.
were not really admiring you. They were like, get out of our way.
Yeah. Get in the middle of the road. Right. Perfect.
That's the plan, Tracey.
That's a good plan. I'm excited.
All right. So
Okay.
then we'll go to vision surgery on Thursday. We'll do the laser technique. Any other questions?
So we had talked about three different things because it's not a cookie cutter. Like you looked at everything that we did and it was either like laser plastique. I'm not sure of the names. So
there are 40 techniques, as you know, Tracy. I keep talking about this all the time. I hate the fact that it has come down to patients asking for, can I have LASIK?
right,
That's like saying, can I have a burger?
right,
Well, you first need to find a master chef who can make more than a burger, who
right,
can have unlimited recipes, vision recipes
right,
with ingredients.
right,
Now you pick the technology. So if you
Right.
think about it that way, LASIK is just one among 23 laser vision techniques that I do. Laser plastique is something proprietary I've developed over years, 3 decades. And then there are lens-based techniques, then there are combinations. So you can custom design to a person. So instead of asking, can I have LASIK surgery, you should go up, or any patient should go up to a doctor and go, hey doc, here are my eyes, here are my issues, near or far-sighted astigmatism, night vision, reading, whatever.
right.
Fix it all, please, and design it to me. So you don't end up with dry eyes, double vision.
So it's like on a menu, like this is what I have. I have dry eye, I have this,
Pinguecula.
I have this.
Previous
and
bad
then you
LASIK,
make
fix it.
and then you make the plan for how you're gonna do it. Not just like LASIK is just
No.
you know.
That's why you saw these patients coming from all over the world again while you had arrived.
Yeah.
All of them had bad outcomes of these surgeries. It's not the patient's fault.
Right,
But
Right.
the way it's been presented is, can I have a LASIK and what's the deal and I'm wrong?
Right.
What is
Yeah.
the surgery designed for me?
right,
Laser plastique, according to me, is years ahead because there's no cutting, no blades, no dryness, and you can fix all these techniques and fix your previous LASIK or cataract surgeries and address people with dry eyes like you with Pinguecula.
that's amazing. That's why I come to you. That's why I drove all the way to Florida. That's why it's my fourth time here because you're the only person I will let touch my eyes.
Pleasure again, Tracy.
Yes.
Look forward to this.
Me too?
See you.
All right.
Wonderful.
All right. So I made it to Jacksonville and after my first pinguecula surgery, I sent that to you. And I know you get a lot of gifts, don't you?
I know it's on my desk though.
It's on your desk,
Yes,
yeah.
it is. Absolutely.
Yeah, I've never sent a present to a doctor before, let alone in another state. And so I was kind of telling you that I have a new channel when I started my van travel, just like 2 months ago. And it's called AD-VAN-TURES over 50. And I, in 9 weeks, have over 11,000 people following me.
Wow.
And so and I've been telling them that I coming here for surgery and then I was going to take them along on the adventure.
Okay.
Because they're all like my demographic. And I first was going to ask you too, so people from all over the world fly to see you. And I was just telling you, I will not let anybody else touch my eyes other than you. That's why it's the fourth time that I've come to Florida. And in the beginning, I came because I had pingueculas.
Yeah.
So can you let them know what a pinguecula is?
Sure. Absolutely. So Pinguecula is that tiny growth on the white of your eye. We call that a sclera, right? It's usually in the medial aspect. It's a little yellowish lump that you may have, and that has red blood vessels in it and makes your eye look red and congested all the time, and it irritates people not only from the looks of it but also from the associated dryness. Tracy, if I may,
Yes.
had 4 pingueculas, one on each side of her eye,
Yeah.
and that's why she's here for the 4th time.
Yeah.
She's actually a perfect example, like all my patients, where safety is very important to me. I do not advertise at all. I'm in love with what I do. It's a passion, and I cannot thank my patients who come here from all over the planet, and then they support my passion. And I think, Tracy, you're among so many of our patients who actually answers other patients
Over
who reach
100.
out to you.
Because I videotaped my first time coming here. Because
I remember you came in and you
yeah,
put the video
I
in my face.
remember.
It's like,
Yeah, I'm like, can I videotape this? Only because I searched and searched and searched. Like I went through down a black hole on Google, and I could not find, like, nobody would give me the outcome. Like, it would be a video, and then I'd wait for the after video, and I would never get it. And I know, and it was affecting me. I was depressed. I had anxiety. And it was affected my confidence, my self-esteem. And like I said, you gave me that back. And that's what it does. I mean, it affects people. It's for a lot of people, it's cosmetic and how they feel about themselves. Because there's a difference between a Pinguecula and a Pterygium. And Pterygium starts with a P, if you don't know.
Yeah.
Yeah.
So on the white of your eye, now Tracey looks fantastic. Her sclera is very white, as you can see here, and that's why she came here 4 times. Safety is very important to me, so I refused to do both sides of the eye at the same time. So to keep the safety, she flew in for each lesion a certain time, and today she's here to fix her. You had LASIK and
my blurry eye. I told them about. I've been driving with my old glasses.
Yes, amazing.
With one eye.
Yes. So she's had LASIK before in Minneapolis, and this time she's come here for her vision, and I'll be doing a laser plastic surgery to fix that and correct her previous LASIK. So on the white of your eye, the sclera, you can have a small growth called the Pinguecula, which is a yellowish growth with reddish blood vessels. When it gets bigger, like the wing of a butterfly, it's called Pterygium with a P silent, like a pterygos, or wing of a butterfly. And both these conditions are sometimes interrelated and usually have dry eyes as an important part of the problem. So most of these patients have dry eyes, they have red eyes which are always irritated. And as I keep teaching all over the world, I've actually shared 3 decades of my surgery work in a textbook I've written for eye surgeons. Yes, you have.
I asked Tilly to grab it for me,
Okay. So I've been sharing and teaching because I believe this is a real problem. I don't want doctors to belittle patients who complain about this and call them vain. It's not vanity. I have patients who've come here from all over the world, Japan, Australia, Hong Kong, far away, of course, all over US and Europe. And they are really bothered by this small growth. And I've actually listed it in my books as being self-conscious, right up to being depressed. So there is a level I have designed because I've seen patients, men, women from all over the planet. Each one of them is really bothered because they're wondering what are people thinking about them while they look at their red eyes, right? So while I encourage surgeons to rise up and perform these techniques that I do, which is a no-stitch technique, it's called SPARKLE as an acronym, which is sutureless pterygium or Pinguecula removal with corneal clearance, which means your cornea is not cut, there is no blades, and this way your vision is either preserved or improved with surgery. Now a caveat, I'm seeing a number of patients who are coming to me who want it to work like magic. Now it does. As you remember, Tracey, I've done that with you every time. It is my rule in my institute that next day after this surgery, I make the patients walk up to the mirror. It's called the Gulani mirror test now, which is holding me accountable. It's very important. In fact, with you, I also did this, which I do a lot with patients. Right on surgery table, I made you see a mirror. So I do believe the immediate surgery outcome is important to show that the surgeon accomplished everything. The next day is very important because the patient in the mirror is actually signifying or validating that the surgeon accomplished the goal. From then on, the healing of that patient, like in any surgery, is going to decide your final outcome. And that's where I want patients to be careful. Some patients have taken it very easy. They've gone to the beach, they go traveling, they go roaming around, and I say, please don't do that. Think about this. Even plastic surgery doesn't come close to this surgery because it's very accountable. Your eyes are open every second of your living time. So actually you're looking at it, or people look in the mirror. I mean, it is very high accountability. That's why many surgeons are afraid, but I keep encouraging them that at least try. Patients don't expect miracles, but can you at least try? No need to take stitches and leave patients red or have a very high recurrence rate because it affects their lifestyle. So by treating that condition with the surgery I do in this book, like I've written for surgeons, the amniotic surgery, or the human placenta that I use without stitches with glue, also helps the dryness which is associated. Remember I told you dryness is part of it? And then, having done the surgery so artistically, without lumps and bumps and stitches, you can also correct the vision. Because many of these patients have associated nearsightedness, farsightedness, astigmatism, or reading vision issues. They're wearing contacts or glasses. They can then have laser plastic techniques, which doesn't cause more dryness. There is no cutting, no blades, no LASIK side effects, and fix their vision too. So look good and see good. So I do believe patients should ask their doctors to perform these techniques, and it's possible. Yes.
But that was the reason why I found you and flew to Florida and went down a black hole looking for somebody to do something, because at home I had gone, and the doctor was like, well, I could do it, Tracey, but it would cost this much, and it would take 8 months to a year to heal, and it may turn out worse than original. And I was like, well, how can you not? But they take a piece of the skin, or a piece of the
Conjunctiva.
yeah, from up under the eyelid, right?
Right.
And then they put it over the thing, and it recurs a lot more when they do that, right? Like for your recurrence rate, it's very...
Absolutely, Tracey. I mean, in my book, that's what I did. I actually let other authors also write their experience just to keep it unbiased. Yes, I'm thrilled with the technique that I've honed with this human placenta with glue, no stitches. But doctors are still doing, what they do is they take a piece of your conjunctiva from the eyeball and move it to the affected side. Now, to me, that's, you're of healing this, but you just damaged another area.
Yeah.
And then they're stitching or using glue in a lackadaisical way, like it's not really sticking, and then people have displacements. I do believe this is a very intense surgery. Though for the patient, it's easy. Was there any pain?
No, we were laughing, we were listening to music.
Yes, you are.
Yeah.
And you came out dancing.
And I came out dancing, yes.
So I don't want you to take it lightly,
No.
but I do want, as I continue in my profession, first I'm enthralled with the results I have, and I'm indebted to my patients and their trust, because like I said, I don't advertise. I'm blessed with all of their desire for me to keep on going. At the same time, I have another desire, which is I keep teaching my colleagues in industry, selflessly, for them to learn and rise, that this is the future. You must perform at this level so the patient can enjoy their life. And the patients themselves should understand that this is not magic. It is surgery. Your personal healing pattern will decide endpoint. And if you've had multiple failed treatments before, you met some patients who were here who had multiple.
Jeannie.
Oh, yes. She is, I remember all my patients, remembers? Oklahoma?
Jeannie, and she had 4 reoccurring
Correct.
pterygiums?
Correct. Yes. And Pinguecula, which we correct.
Yeah.
And she had both sides of her eye.
Yeah.
So, very important. This is not only for patients who are watching, because here we are at the end of the day. Actually, I've been with patients all day, but when my patients ask for something, it's a pleasure. Tracey and we are sitting here impromptu, just chatting. There's no preparation. It's from my heart. I do believe not only should every patient get relief, but the doctors, I want you to encourage them to rise.
Well, and it's not just, you do all sorts of, I don't even know what they're, MRK? I don't know the names of all the
vision corrective?
All the vision
Absolutely.
correctives, yeah.
To me, it's so simple, Tracey. We were talking about this in the lane when I saw you. This is completely wrong that people go asking for a LASIK or a SMILE or a PRK and the doctors also, I keep telling them not to talk like this. You are not a LASIK candidate, okay, I'll do PRK or I'll do this. That's wrong. It's like saying, burger's not good for you for lunch, let me give you a hot dog. Well, that's because that cook knows only those 2 things.
Right.
You want a master chef who can do over 40 different techniques and unlimited custom designed vision recipes for you with technologies. So there are 40 different techniques I use, unlimited combinations with every laser and lens technology we can design to the patient. So even if Tracey has had previous LASIK, which she has, not only do I want to correct her day and night vision and reading, but also fix that old LASIK wrinkles that she has in her flap. Very important. So when you want vision corrective, if you're wearing glasses or contacts, there is no such thing as not a candidate.
Yeah.
Let me repeat this. There is no such thing as not a candidate.
Well, this brings up, so one of my followers or subscribers had said, when I said I was having vision correction, he said, oh, my ophthalmologist told me that you can't correct vision after 40.
Wrong. So after 40, what we also have patients going to is called reading vision issues, right? It's called presbyopia because your lens in the eye stops zooming. So you zoom with your arms. Okay. So that's called presbyopia. Now, again, it comes back to my explanation to you. If the doctors know only 1 or 2 or 3 techniques, and if your condition falls outside that, then you're not a candidate. Therefore, this is completely wrong. As long as your eyes are safe and healthy, you're over 20 years of age, and you could be 200 years of age, you are a candidate. As long as your surgeon knows how to design a technique to you and how to use technology to that design. So please remember this. As long as you're wearing contacts and glasses, and you're over 20 years of age, you are a candidate, as long as your doctor can custom design for you.
cannot settle for cookie cutter surgery. Please, over 80% of my practice today is fixing complications. Not a single time have I met a patient who was of low IQ. The patient was very intelligent, but they fell for the same advertising gimmicks that go on. Cannot do that.
And I was telling them too, I'm like, I call Dr. Gulani a friend, and I call the staff a friend, and they said, and it's not just me, you walk out of here too, like being, because you're the only surgeon I know, you call after surgery to make sure people are doing well, you follow up afterwards. You're the only surgeon that I know, like if I had a question, sometimes people have too many,
Yes.
you could call and say, hey, and I said to you one time, I go, how come you call? Because usually you can barely even get a nurse to call you back. And you said, well, Tracey, I do the surgery, so I know, so I should be the one talking. And, we talk about that, that's not normal. And also, even from the beginning, like when you walk in, like, it's here at 9:00 and there was another person here and they come and you're here most of the day because you're doing tests and going in and out, and then you're with Dr. Gulani and the staff for a week. It's not just oh, you come in for your 15 minutes, get your tests, and then, here you're going to get the #1 special today, and then we'll do that next Thursday. It's like he spends all this time with you, so does the staff, explains to everything, talks about what the options are, and you make a plan.
And I don't give you options.
And but you know what you're doing, so
Absolutely.
you give us a plan. Yes.
Absolutely.
And that's what made me confident, because when I talk to you, and that's another thing I want to make sure people know is that you're the only surgeon too that I know, so you can go on the website and write in what your problem is or whatever, and people can have a free consultation with you. The staff has them send their I know for me, my records from my ophthalmologist or whoever.
We're making that even more streamlined actually for them, because what we're running into, a lot of patients just send some random test their doctor did, and they're sending it from different parts of the world. It's different language, different formats. So we have made it custom design on our website now as a place where we call
to drop it
for patients. And they can now see there's an exact form that your eye doctor needs to fill.
Oh,
so you don't go through the hassle. You're a patient. You don't need to have any more hassles. You just have your eye doctor fill in that form, send a picture, and we are very clear. Now, I do this as a service for patients because so many patients fly to us from all over the world, and it's important. I take it personally that y'all are coming, there is trust, y'all are spending money traveling, coming with families, being off work, is how can I be so ready for y'all? Hence my weekends are spent planning for y'all. Today is Friday, Tracey's here. You saw all these patients leaving today, having fun. Patients Monday will again arrive, another 18, 19 patients will land from all over. Patients who've had complications of LASIK, real keratotomy, dryness, bad pinguecula surgeries, or patients who are virginized but are just very demanding, who want the best outcomes. And it becomes my responsibility to see you go through very advanced diagnostics like you did today, and then sit down and make a plan after I look at you. If this was my family, what would I want? And am I still capable of performing that technique which they deserve? Not the few techniques that I want to do. And that technique should be designed to that patient.
But you put aside then time every week to talk to these people and consult them without charge before they even come, to tell you what your plan would be. If they came.
Yeah, more or less the plan, because on telephone that's all you can do.
Right.
But now we have it very streamlined, in fact even more than before, where there's a form that they can fill, their doctor can correspond.
Perfect.
And then I actually give time on that. We do like a teleconsult.
Yeah.
And that's another thing, important.
And I'll put all the information, like the link to the website and the phone number and everything.
Sure, yes. Absolutely. So it's very important to me, just because you can surely fly to me. I just like to do this. I think they have a form already up there, and there's a nominal charge for it. There's a form, there's a video conference option, there's a teleconference option, and then from there, at least I know 80% what you're coming with.
Right.
So because I want to be ready for you. I don't want to be like you traveled all the way, you spent all the money, came with family, and I go, oh, this is not stable, come back.
Right.
For surgery. So again, there's nothing wrong if a doctor does that to you, but I just don't want to. I want to make sure when you're coming to me, I'm ready with everything for you and receive you here where you feel like family and really perform the best I can.
Well, it really, what percentage do you think fly to you?
Of
just from, I mean, people fly from all over the country.
Yes.
You know, I had made a video about my Pinguecula, and then that's people started writing me because they were so thankful that I had showed like my outcome and so
recently, the two people who had spoken to you, the plastic surgeon
Emmanuel.
from Germany.
yeah,
I
he
just
came
did his Pinguecula and I did his laser
and
plastic
his laser
vision.
plastic. Yep,
Recently, the other one from Italy,
Italy.
Anna.
yep.
She also was here. They mentioned you. We had fun talking
So
about you.
I have friends from all over the world because of this.
Because of this.
Yeah, from Ireland, from the UK,
Pink pals.
Ping Pals, yes, and then Annie and Lee
yeah.
were here. So yeah, so I've made a lot of friends, and you know they reach out to me because they want to make sure that this is real.
Well, let me say something. Yes, that's important, Tracy, but let me say something to your audience. I'm indebted to my patients, especially Tracy. I mean, all these patients of mine who spend their time answering these patients. And very important, please, there is no incentive for them.
No.
I mean, there's no Starbucks card, there is nothing.
Other
than-
no Starbucks, other than helping other people, because I knew what it was like
But
to
still,
feel
Tracy,
that
still,
way.
you know, the world is so full of commercialization and
Yeah.
advertising,
Right.
marketing, and
Greed.
gimmicks.
Yeah.
It's very important that this be very clear. My amazing patients are doing this on their very important time, on their own accord, going back and forth. And I know the most common question you get is he real?
Yeah, right. Yeah.
I'm real.
He's real. Yeah, he is. So, I mean, yeah, thank you. I mean, from the very first time I came here, every time I come, we make videos. And now I'm having something different. I'm having vision correction. So I really wanted to do another video because people have called, you know, I did my third Pinguecula, I made a video, and I said, you know, because you don't like to talk about your Pingueculas. I mean, I don't keep pictures because when I see them, it brings me back to how I felt. You know, because people will ask me and I don't want to even go through it. And I said, I made the third video and I said, you know, I really don't want to do this because I'm kind of done talking about it. Do you know what I'm saying?
Sure.
But it's for other people that I want to tell other people, because this first one was the lateral,
Yes, yes.
No?
Exactly.
because the other two were the inside ones.
Medial ones,
The
absolutely
medials,
correct.
yep. And so, but that's why I want to keep sharing so that people know, like, I didn't just come once. I came 3 times and now it's my 4th time.
Yes, absolutely,
yeah.
absolutely, Tracy. That's underscoring the safety level of cannot compromise safety.
Right,
These are elective surgeries.
right,
It's not like it's urgent surgery.
right.
You have to. You as patients must do your research and do
Right.
not fall for these charlatans and advertising gimmicks, please, because I hear it all day because all these patients are sitting in my institute. Doctors who claim to be experts, ask for proof. Ask for how many decades have they done this. Ask if they've written a textbook, if they've published papers, if other surgeons have seen their work. Do they teach courses? Not locally in some restaurant where they're paying for some, you know,
Yeah, to
they
sell more.
yeah, it
surgeries.
should be at the American Academy, the
Right.
American Society of Cataract and Refractive Surgery. Please do your research.
And you
Don't
travel
jump
all
in.
over the world to speak, all over.
It's a passion and I love it. So many invitations I can't even keep up, but I love sharing with my colleagues, love sharing with industry that this is the future. Technology I've designed, new instruments as you know for Pterygium. I even changed colors like I did for you.
Yep. He's very into fashion too. You have a fashion,
it's
new
fun.
colors of scrubs and everything. Yep.
So I truly believe it's more than a passion. It's a calling. So not only, I mean, as I told you, it's the end of the day today. We've seen patients all day. We've had fun with everybody flying out, new patients landing. And Tracy and here we are, end of the day. There's no makeup, there is no script, there is nothing, and here we are.
No.
So guys, any
Yeah.
questions, please, you're more than welcome at GulaniVision.com. And of course,
Yep.
please, Tracy, don't spend too much of her time. She's amazing, but
You can reach out to me. I got nothing to do but travel with one eye across the country.
I hope
Now I'll be able to see now of 2 eyes after
Now
this.
you're
I'll
driving
have
the
lots
center
of
of the road,
time.
yeah.
Yeah, exactly. I can go twice as fast now. Yeah.
Right,
So,
right.
well, thank you for taking the time to even sit down and talk.
always,
Yeah.
always.
All right.
Tracy,
All right.
great seeing you.
Let's do it.